I mean, it's really scary. These are the people who are supposed to be the most compassionate, the people who will say that everyone is entitled to quality health care, but they're uninformed, they're not listening, and by not listening, they're essentially redefining the word everyone, that everyone doesn't include LGBT people.
I don't know if I'd have come this far without you. I couldn't tell a lie from the truth.
I mean, I had a patient a few months ago, and this person prolonged health care for 2 decades, 20 years, before he came back into the hospital. And by that time, his diabetes had gotten so bad that he lost his leg. And this stemmed from a healthcare provider not listening to his story and simply telling him that what he was doing was wrong and leaving the room. I mean, healthcare providers are walking out on the people who sometimes need them the most.
These disparities stem from a series of different factors: legal factors, structural factors, social discrimination, and a lack of cultural competency by our healthcare providers. It stems from a continuous failure of our medical institutions to acknowledge emerging social norms and to give credence to gender identity within a service-oriented context. Because of these failures, many individuals continue to suffer and not get the care that they need. I mean, it's about a clear lack of training for these doctors, for these medical staffs that aren't acknowledging the patient. And it's so much so that it's creating a barrier between the doctor and the patient, so that these people are not getting the care that they need because of a simple lack of sensitivity.
In order to kind of break that barrier, the first step could be something as simple as changing forms, changing signage within an office to let LGBT people know that they're invited, that they're welcome. I mean, it's all about creating this environment that's inclusive of all LGBT people. Anybody that walks into the office is going to be heard.
So I really do think that it doesn't just end with doctors. I think staff and anybody else who's dealing with patients in a hospital really need to consider what their patients want to go by. Anybody in the LGBT community has a preferred title, and it's important that we respect that. It's not just, a line everyone's divided against. It's a very gray area, and it's important.
Respect the patient.
Respect the patient.
Respect the patient.